I had great parents, a great family. I was the oldest of four kids, 3 brothers and sisters. When I was a sophomore, my mother was the mother of the year, and I was the student of the year. And my family was incredibly supportive.
She loves her kids passionately. She loves her grandkids even more passionately. She's very family-oriented, and she's really a delightful person to talk to.
My interest in medicine is, in the medical field particularly, is a very interesting sort of one of those steps as how they develop in ways which we never anticipate. I actually came to Manitoba in the business school.
I have known Noralou for 31 years. We worked together at the Manitoba Centre for Health Policy, where she was the founding director in 1991 when she hired me pretty much fresh out of finishing my PhD. Noralou pioneered the use and linkage of routinely collected administrative data for research purposes. When she and her husband, Dr. Les Roos, moved to Manitoba in the early 1970s, they recognized the potential of the information that was being collected to administer the provincial health system.
Not only did I spend a lot of time actually doing research, I ended up spending a lot of time working with the media, trying to make sure that evidence gets correctly reported in the media. We've uploaded advice to academics as to how to do it, so all of that we have made available.
She was able to, first of all, find a really powerful space connecting public healthcare with frontline healthcare and frontline medicine in ways that sort of wove in her interest in addressing social determinants of health and other sort of big level causes of health into the way we actually practice care.
Populous is the population-based health information system, and I just picked up this book. It was a supplement of medical care, which is the official journal of the American Public Health Association, a very high-profile journal, which did a whole supplement on our system. Because what we were able to do was to use this population-based data to look at how Manitobans, how individuals access the healthcare system. As part of Evidence Network, a physician in Toronto, Dr. Gary Block, who heads an inner-city clinic, wrote an op-ed in the Globe and Mail saying, "This time of year, I prescribe filing taxes to my patients."
We became connected after she got interested in a project I was involved in around helping people access income benefits, or really money, in healthcare settings.
And the fellow who's head of the Winnipeg Foundation phoned me up one day and said, "Noralou, do you think that health inequity issues are a problem in Winnipeg?" And I got back to him immediately and I said, "Absolutely, this is a very big problem." So we ended up developing a booklet. We've now distributed more than 150,000 of these booklets, and it's been a very interesting project.
She has been an innovator. She's before almost anybody else in the country. She recognized the value of utilizing the data that governments collect to help governments shape their policy.
Her pioneering work in the use of linked administrative data for health and social determinants of health research, and her contributions in the area of evidence-informed decision-making have been adopted around the world, and so it's influenced the care and services received by populations not only in Manitoba, but across Canada and around the globe.
Trailblazer in the use of big data to inform policy and better understand the social determinants of health. Canadian Medical Hall of Fame laureate, Dr. Noralou Roos.